Mental health professionals are trained to help other people through trauma, but what happens when they start burning out themselves? Hi, I'm Shaylin, and I'm a Bachelor of Social and Community Development student at Sheridan College, and I did my capstone research project on mental health resources for mental health professionals. I interviewed 5 mental health professionals in Ontario to learn more about their self-care strategies, the resources they had available to them, and the barriers they faced when accessing them. What I found was both extremely powerful and concerning. Mental health professionals are often exposed to secondary trauma, compassion fatigue, heavy caseloads, and high emotional labor. Research showed that working with high-risk and trauma-exposed clients increased the likelihood of having burnout. But despite the heaviness of the work that mental health professionals do, there is such a kind of idea around they don't need help. They're fine. The research I did in this project challenged that assumption and that stigma. Throughout my project, I found 4 major themes that I would like to share. The first theme was that every professional had self-care strategies that they used to manage their own well-being. Themes included things like personal therapy, exercise, team sports, hobbies, and so many other things. There were so many things that people used as self-care strategies. One participant even shared that they felt that being in therapy in this field was essential for their own well-being. These findings aligned with prior research showing that emotional regulation and peer support protected people from distress. However, it's important to note that self-care strategies alone will not prevent workplace burnout. My next theme pertained to professional supports that these professionals had through their jobs. Some workplaces offered things like supervision or an online portal, but these were often perceived as kind of surface level and inconsistent. One participant noted that their online portal literally felt like talking to a robot, and it was not effective. Some prior research highlighted gaps in employer-provided resources for mental health. This is why a lot of the professionals relied on personal therapy, because their professional supports were just not good. And it shows a big disconnect between what is needed and what is offered. My next theme was based on burnout, and it was challenges that factor into burnout. Participants described things like low pay, staffing shortages, high caseloads, and unsupportive environments as things that contributed to their workplace stress. Some participants talked about staying late to complete documentation, and others felt defeated when their clients came back and had relapsed. This also connected to findings from prior research where they talked about working with clients that have previous trauma exposure can increase your risk of burnout as a professional. Finally, my last theme was about workplace cultures and environments. Some participants described really enjoying their environments and they were extremely supportive, while others were toxic and high pressure. Workplace culture was a big topic when asked about job satisfaction. Prior research noted that organization systems and policies impacted workers' mental health. Here's my one big message. Mental health professionals are doing their part. They practice self-care, they're aware when they're burnt out, and they are trying. Workplaces just need to do more. Self-care does not replace staffing models or a wage of an employee, access to mental health supports that they need. Supporting a professional is going to support the entire mental health system in Ontario. So if you're a mental health professional, please listen up. Seeking help is not weakness, it's ethical practice. If you're a student entering this field, build habits early. If you're part of leadership or management in an organization, invest in real supports. Give your employees real supports. When we support the supporters, everyone is going to benefit. I just want to say thank you so much for listening to me speak about my topic. I hope you found this educational, and if you did, I would really appreciate it if you shared it with your colleagues, your friends, or anyone you feel might benefit from this. Having this knowledge out there and this education is part of the next steps in solving this problem. Thank you so much.